Hi everyone, welcome or welcome back. Several weeks ago, I talked about why I didn't quit my job and why I was actually happy and glad for it. One thing that I didn't talk about, and this is something that has been on my mind, but I think it didn't come up. One of the primary reasons is because I am currently on my health insurance as well as my spouse. If I left my job, for those who are not from the United States, then I would be able to continue on something called COBRA, which is a continuation of benefits, but it's really expensive. In the United States, the company subsidizes a portion of benefits. It might be 50%, 60, 70, depends on the company itself and what they want to pay into. My husband as well is on my insurance because we have a better insurance at my company. His insurance is pretty expensive for the coverage that it provides. So actually, I didn't talk about this because I don't think a lot of people would have cared, but it seems like people do. If you haven't been following the news, you probably do not know who Luigi Maggioni is. If you have been following the news, you know who that is. So Luigi Maggioni is the alleged murderer and suspect currently in the case for the killing of the health insurance CEO, Brian Thompson. And it's been quite an interesting response. This has sort of united both sides of the political party. If you're not familiar with the United States, we get our health insurance from our employers. Essentially, the way it works in the United States is that typically you will not get a subsidized health insurance unless your employer does so. The Obamacare you may have heard of, which is the Affordable Care Act or ACA, was something President Obama during his presidency pushed, and it introduced a lot of different things. And one thing that was really great that was introduced from the Affordable Care Act, the Obamacare, was that pre-existing conditions were no longer something that you were legally allowed to deny people. So an example is that if, let's say, someone was diagnosed with cancer or they had a heart condition, then in the past, insurance companies can say, I'm going to deny your coverage and not pay for XYZ because it was a pre existing condition. Because of the Affordable Care Act, Obamacare, this was now illegal, which is amazing. I think that what has happened, although I don't advocate for violence, and I think people dying is something that I am very saddened by. However, the public outrage of just getting claims denied and services delayed is really uniting Americans from all across the political spectrum, which is so interesting. If you read more of the mainstream news nowadays, it's really trying to paint Luigi, who is the suspect, the alleged murderer. You know, he's innocent until proven guilty in the court of law. They're really trying to, this mainstream media owned by really rich people, right? The billionaires are really trying to paint this picture of Luigi, but the everyday people, if you go on to YouTube, you read the comments, if you go to Reddit, if you just read comments from the everyday people, people are so upset at health insurance companies, and it's really sad because for the longest time it's been normalized that health insurance companies can delay your coverage if they say this is not something that is allowed. There are some videos from doctors as well talking about, and even other healthcare providers talking about how they have to jump through hoops. It's definitely also personally impacted me, which I didn't talk about because I didn't think anyone would care. I didn't quit my job because I was afraid of my health insurance coverage. Unlike other countries that may have universal health care, and I know a lot of folks say there are problems with their insurance and, universal health care and maybe getting coverage as soon as possible. But it's just really sad that people in America are literally going bankrupt, dying because they cannot afford the services that they need. One thing that came to mind was when I read how there was a disabled child and they were trying to get a wheelchair, and the insurance company said that they should look into a cheaper model. they were disabled and couldn't walk, and it was just really sad. I mean, obviously I'm not a doctor, but this child would never be able to walk, and it's like, oh, get a cheaper version, things like that. But to add on to this, there were other people talking about how there was a child that they were going through chemotherapy because they had cancer, and the insurance company denied their nausea medication. So just things like that, which is really disheartening. I mean, personally, I've also dealt with insurance, which I fortunately, knock on wood, I'm knocking on wood, that I haven't had such severe circumstances, but it's in the back of my mind. My experience was that I am going through therapy, and my therapist on the website, our health insurance website, lists that my therapist is in network. But then for some reason, when they went to process the claims, it was showing up as out of network, even though their website says it. That gave me so much anxiety, and it's just unbelievable. I mean, the fact that I'm pretty financially secure, and I think that, I've done the right things where I save my money, I've saved towards retirement, I don't overspend, but for myself, I also am scared because I think I went through like maybe 9 sessions, and then I found out that perhaps this may not be in network. Fortunately, I have proof that they are in network, but just going through that, even though it's like a very minor case, was really stressful, and it scared me. I want to talk about this because I really hope that change comes from what has happened, in the sense that people and companies should not prioritize profits over people's lives. It is such a terrible situation that companies can make so much money off of people's suffering and basically lives and their healing. That is just so unacceptable. We'll see what the trial looks like, and it's just really disheartening too that when people speak up about this, that it's being censored. I saw on Dr. Gooby's YouTube channel that they demonetized his video talking about this. It was just kind of interesting because perhaps they don't want folks being copycats. I can understand that. However, this is the state of reality, that health insurance is super expensive and people are not getting the coverage they need. Our life expectancy isn't higher. So why is that the case? I don't know if this is the actual document from Luigi that they found, but it was published to say that we are number something in life expectancy, and however, we spend the most money on our health and excuse me, I'm getting choked. Excuse me. I'm getting choked up talking about this because it's such a difficult conversation to have. I really feel for folks who basically lost their entire life savings because they were unlucky and maybe they got cancer and whatever health conditions, and they had to literally fight health insurance companies to get the coverage they need. So definitely a scary thing. I don't know. I want to be hopeful. I want to be optimistic that this is starting conversations, and I hope there is reform and that there can be positive change, in the sense that why is it that health insurance companies are allowed to tell healthcare professionals that something is unnecessary? And one thing that really kind of pisses me off is that there's this term called medically unnecessary. But should a health insurance company decide that? I don't think so. It is just kind of sad that profits are valued over people's lives. I definitely resonate with the fact that it's really sad, and it's really just scary that healthcare in America is for profit. It's a scary thing. I think that if lives and people isn't tied to it, sure, make as much money as you can, but the fact that people are getting bigger bonuses for denying claims is just crazy. It's scary. And you may be wondering, why did the alleged murder suspect target United Healthcare CEO? And essentially, United Healthcare leads in the number of denial claims. They actually are being sued because they created a software that automatically denied claims, and it was about 90%. It is just truly sickening and sad. These denied claims do have ramifications on human lives. I don't know how to speak about it without being emotional because that's just really horrendous. And I think that it's so easy to go about our lives and not talk about these hard topics. But if we don't have these conversations, change won't happen. I really want to be part of that conversation. But yes, so one of the reasons why I didn't quit my job was I was scared of losing my healthcare coverage. My husband's coverage wasn't as great. It was really expensive for the coverage it provided. I was scared I'll get sick and I'll need it. I mean, generally I'm a healthy person, knock on wood, but here in America, I mean, our insurance is through our company. One thing I didn't really mention is that through the Affordable Care Act, Obamacare, there is the healthcare marketplace, which means you can buy insurance from this something called healthcare marketplace. However, the subsidies are based on your income. So if I were to look into the healthcare marketplace, my overall income, because my husband would be still working, probably wouldn't get much. So it's really crazy. And I guess to demonstrate how expensive health insurance is, I recall, and this was many years ago, so it may have changed. I remember seeing like Cobra, which is the continuation of coverage, for like over $1,000, and that's just one person. Maybe, well, it depends on the type of coverage, but that's a lot of money. Imagine paying $12,000 for health insurance, and that doesn't really cover everything. That is just covering towards your, you gotta pay towards your deductible. You have co-pays, so if you have any prescriptions that you need to get, that's also expensive. And with the conversation of prescriptions, that gets into another bucket that I don't have time to talk about, and I don't want to derail this conversation. It's just like really absurd how expensive things can be. Right now, I would say like a very affordable health insurance premiums, which is every time you get paid, you pay towards your health insurance, is probably like, $20 a pay if you're paid twice a month or every 2 weeks. That's pretty reasonable. This is something so dear to me, and I'm familiar with it because my first job out of college, I actually worked for a company that didn't provide great insurance. It was really interesting because they actually tiered it based on where you fell based on your salary. I made the least amount, of course. I fell in that cheaper bucket, but I remember paying like $100 a month. And if you're familiar with health insurance, I had a high deductible health plan. So this was not even a copay PPO plan or HMO plan. This was a high deductible health plan. And this was over a decade ago. So the fact that I had this coverage literally gave me so much anxiety because if I were to do anything outside of the preventive stuff that was covered, which was like once a year checkup, like let's say I broke my arm or something, or I caught like a flu, that would not be covered under my insurance, and I had to pay towards a certain deductible before my insurance starts paying. And then similarly, if I needed prescriptions, I would also have to pay towards the deductible, and I had to pay full price for the pharmacy prescriptions, which was very expensive. So I think because of that first experience of having such expensive healthcare and being someone fresh out of college and being from a low income household, I really didn't feel safe because if something happened to me, I can literally go bankrupt. This is something really dear to me, and I guess for those who are more savvy, or maybe you're not and you want to learn. So the way health insurance works is that the company can actually go to different health insurance companies to figure out what the premiums will be, and depending on how the company is, like if it's a bigger company, they may decide to self-fund themselves. So that's a little bit more flexibility on the company's end. They can design their plan, but then if maybe you're a smaller company or you just don't want to deal with it, you can actually join something that was already created, and there's a little less flexibilities. So there's so much involved in this, and I guess the more I talk about it, really health insurance is like the middle person or the middleman between the person needing the care, right? And the hospitals, urgent cares, the specialists, whatever that may be. And it's very frustrating because if, let's say, the health insurance doesn't contract with certain healthcare providers, then they're considered out of network. And if they're considered out of network, then you would be responsible for basically more money because there's no discounted rates. And usually in network is better because you get the discounted negotiated rates. If you go out of network, if let's say the healthcare provider decides to balance bill you, then you would be liable for the remaining amounts above what they may recommend. So it's definitely very stressful if you ever encounter insurance and going to the doctors in the United States. It's just kind of scary that for a country as rich as the United States that we have this problem. And it's just so unfortunate that it's just making companies richer and richer. I recently saw a video where Elizabeth Warren was questioning the United Health Group CEO. So this wasn't the United Healthcare CEO, this was the United Health Group, which is the bigger overall umbrella for United Healthcare. His name is Whitty, I believe it's Andrew Whitty. Elizabeth Warren, who's a senator, can't remember which state, but she was basically questioning Whitty and asking him about how much they made. And there was, I guess, a issue where some bad actors hacked the data, and so data was released. Unfortunately, with that releasing the data, United Healthcare decided to use that information and they tried to buy out that health group, which was very interesting. I think it was like a maybe physician group or something like that. Don't quote me. Then I remember Elizabeth Warren asking Whitty, does that mean that United Healthcare will get bigger? And I don't remember what size United Healthcare is, but it is a very large company. And so Elizabeth Warren asked Whitty, does this mean that you guys will get bigger? If you've been following the case of Brian Thompson murdered in New York City, when the police were looking around Central Park, which is where they think the alleged shooter ran towards, they found a backpack that they saw in surveillance cameras. And in the backpack, they actually found Monopoly money. And I'm wondering if maybe the shooter is saying that United Healthcare is a monopoly. So lots of thoughts and very concerning for American people. I definitely feel for the CEOs who may not feel safe. What is crazy is that in the news, they mentioned that the CEOs actually ramped up their security. So rather than addressing the actual issue at hand, they're like, all right, let's protect ourselves. I feel for them, right? Like, I don't think anyone should be killed. It's kind of sad that it takes violence for companies to take it seriously and start considering the lives of other people. Lots of comments have said things like all the denied claims that these healthcare insurance companies have basically rejected, denied, delayed, that ended up killing folks, but that was a legal way of murder. But now you have someone who shot and killed Brian Thompson, United Healthcare health insurance CEO. Completely understand the sentiments of folks because there's murders very often. I don't know how often in New York City. The manhunt that they put through in New York City, it was 5 days, I think. The amount of resources, time, money they spent trying to find a killer, which I get it, but it's like, wow, do you need to be a millionaire to be able to have the police care about you? And it's just kind of opening my eyes to the reality of the situation. I'm just very sad. I hope positive change comes from this. I really hope so, because I think what this is showing, right, and people's comments, the outrage for, the lack of sympathy for Brian Thompson getting murdered I think people are just frustrated, and I'm sure if you're American, you probably have dealt with health insurance, or if you haven't dealt with it yourself, you probably have families or friends who have dealt with it, and it's such a struggle. And I'm just really saddened. I really hope that we come out positively for this. I hope people don't continue dying for having coverage denied. I hope that this brings about positive change, and I'm just very, in a way, speechless, but not really. I know this came from me mentioning one of the reasons why I didn't quit my job, but I think this is a very opportune time to talk about it. I'm just very reflective right now. I'm sad. I hope that things will be better. I'm trying to think if I'm forgetting anything that I want to talk about. I think I covered it all. I hope this video was helpful for those who may not be following the situation. Let me know if you agree or disagree. I'm not sure if you're from the United States, but that is the state of our health insurance here. And there is so much that I think we can improve. I can link the video with Elizabeth Warren questioning the United Health Group CEO Whitty in the description box if you want to look at that. But I appreciate you listening. I think this is probably the longest time I've talked, so hopefully you're not bored. I hope to have a positive update in the future about this. Thank you again for listening, and let me know if you have any thoughts. If you haven't subscribed, you made this far, please subscribe, and I'll talk to you soon. Thanks so much, and I'll talk to you soon. Bye.